Hey friends, welcome back to Programmer's Vision. Today we'll learn something amazing about first aid kit. So let's get started. So first let's start with an introduction. Like, what is a first aid kit? A first aid is a provision of initial care for an illness or an injury. It is usually performed by a non-expert or untrained person on a sick person or an injured one until the required medical treatment or aid arrives. It generally consists of a series of simple and potential life-saving techniques that can be performed with minimal equipment. We should always keep a first aid box at home, at school, at easy, so that it can be used whenever a need arises. A first aid box contains necessary medical items such as antiseptic lotion, antiseptic cream, band-aids, a pair of scissors, cream band-aids, some painkillers, and etc. So now let's learn about different types of emergencies where we have to use the first aid kit. First one, first aid for cuts. It's natural to get a cut anywhere. If a cut is severe, get to the hospital right away, or if you must wait for an ambulance, begin the following treatment. Rinse the cut or wound with water. If the wound is small, then apply some direct pressure to the wound by hand. This will help stop bleeding. Raise the injured part to reduce blood flow to the wound. Place the person at the rest and quickly cover the wound with dressings and continue keeping the pressure with the bandage or a clean cloth. Then the next one is, before applying a bandage to the wound, check for the circulation below the injury and then bandage the injury. After bandaging, check the circulation below the injury again to ensure that the blood flow has not been restricted by the bandaging. If necessary, loosen the bandage enough to improve the circulation. If the dressings have got blood on it, don't try to remove and continue the pressure. Removing the dressings frequently may disturb the blood clots and expose the wound to the further infection. For severe bleeding, always seek the medical attention. So now we have learned what is the quick treatment for the cuts, and now let's quickly move to another treatment. Now let's come up to first aid for burns. If your clothes or your friend's clothes catches fire, stay absolutely still and follow the given instructions. Do not try to run. Flame needs oxygen to keep them burning. So then, rolling on the ground will stop them flow from getting any oxygen and help them put off. Wrap something like a woolen blanket around the person to smoother the flames. Take off any clothes or jewelry around the burned area of the body before it swells. Use the cold running water for 20 minutes to cool the burn, but do not use ice. Do not break blisters. Exposed blisters can get infectious or septic. If blisters bleed, gently clean the area with a mild soap and water. Apply an antibiotic ointment. Keep the person warm with extra clothes on the unhurt parts of the body. The last one is to see a doctor if the burn is very severe. Now let's learn what to do if you have a fracture. A fracture is a broken bone. If after an accident fracture is suspected, then don't move the person unless it is necessary to avoid further injury. Take the following actions immediately while waiting for the medical help. Apply pressure on the wound to stop any bleeding with a sterile bandage or a clean piece of cloth. Don't try to realign the bone or push a bone that's sticking out back in. Immobilize the area completely. Padding the area can help relieve the pain. Apply ice packs to limit swelling and help relieve pain. The next one is the first aid for poisoning. Poisoning causes injuries or death due to swallowing, inhaling, touching, or injecting various drugs, chemicals, venoms, or gases. If a person is drowsy, immediately take a medical help. If the person has swallowed poison, try to take out all of it if any poisonous substance is still on the person's mouth. Second one, if the person has touched any harmful poison or on the skin, remove it using the gloves and rinse the skin for 15 to 20 minutes. Third one, if poison has gone in the eye, gently flush the eye with cool or lukewarm water. If the person has accidentally inhaled a poison or gas, take the person into an open area with fresh air as soon as possible. If the person vomits, turn his or her head to the side to prevent choking. Always consult a doctor for medical assistance. Now let's come up to the first aid for an object in an eye. Sometimes foreign particles enter our eye. These may cause damage to the eye if proper care is not taken. If something falls in the eye accidentally, wash the eyes thoroughly with water. Consult a doctor if irritation persists and put prescribed eye drops. Next is first aid for stings. Bug bites and stings generally cause uneasiness and extreme pain. However, at times they can lead to an infection that necessitates proper treatment. First one, try to remove the stinger as soon as possible. Wash the area carefully with soap and water. Rub on with an ice pack wrapped in a cloth or a cold wet towel for a few minutes. Seek medical care if you notice a large skin rash or swelling around the sting site, or if swelling or pain persists for more than 3 days. Get medical help right away if you notice any of the following signs: wheezing or difficulty in breathing, tightness in throat or chest, swelling of the lips, tongue or face, dizziness and nausea or vomiting. Now I'm going to share you what to do if your pet has bitten you up. So now let's study about first aid for animal bites. Animal bites and scratches the break skin can sometimes cause an infection. Some animal bites of dogs, rats, bats, raccoons and foxes can lead to rabies, a life-threatening disease. Follow the instructions which I am saying now. Let the wound bleed and then wash the wound in running water for 3 to 5 minutes to remove the animal saliva. Wash the wound properly with soap and water. If the bleeding has stopped, apply an antibiotic or ointment. Consult a doctor immediately. Now, the first aid for snake bites. If you are bitten by a venomous snake, immediately call an ambulance, especially if the area changes the color, begins to swell or is painful. Many hospitals stock antivenom drugs. In case of a snake bite, follow these instructions. Remain calm and move beyond the snake's striking distance. All snakes are not poisonous, don't worry. Remove jewelry and tight clothes before the area with bite starts to swell. Wrap a bandage or cloth 2 to 4 inches above the area which has been bitten. Get doctor's assistance immediately. Now let's learn the first aid for unconsciousness. Unconsciousness is a state where a person suddenly does not respond to any stimuli. It is related to fainting and can occur for short or long periods of time. Main causes of the unconsciousness include the severe bleeding, a car accident, a blow on chest or head, etc. Temporary unconsciousness is seen in people in cases such as low blood sugar, dehydration, straining, and etc. If someone is unconscious, follow these simple steps to make that person conscious. Lay the person on his or her back. Loosen the clothing of the unconscious person, such as any restrictive clothing, belts, etc. Check the person's airway for any obstruction. Check again to see if the person is breathing, coughing, or moving. If these signs are absent, perform CPR. Cardiopulmonary resuscitation or mouth-to-mouth breathing. Kneel to the level of unconscious person's neck or shoulder. Then place the heel of your hand at the center of the person's chest. Place your other hand directly on the first hand and interlace your fingers. Push straight down to the person's chest, keeping your elbows straight and moving your shoulders above your hands. These are called chest compressions. Repeat this procedure for about 100 times per minute. Yeah, you have to repeat this procedure for 100 times per minute. We can also give the person mouth-to-mouth breathing or rescue breathing in between. Continue the procedure mentioned above until the medical help arrives. Now we have came to an end of this video. Friends, thank you so much for watching this video. And please like, share, comment and subscribe to Programmer's Vision. Until then, have a good day and goodbye. But wait, if you are having any doubts related to this topic or any other topic which on the videos which I have uploaded, you can please ask in the comment section below. Thank you.